September is World Childhood Cancer Awareness Month due to the lack of knowledge regarding the disease and how it presents in children. Diagnoses are found later when the cancer has already advanced. DKMS Africa, formerly known as the Sunflower Fund, is focusing on children who have survived serious illnesses to commemorate this awareness this month. Alana James, Country Executive Director of DKMS Africa, joins us now to tell us more and, give more awareness on this. Alana, good morning. Welcome to Morning Live.
Good morning. Thank you so much.
Give us background. Share some childhood cancer, and what causes this.
So, look, there are many different causes for different types of cancers and blood diseases. And I think, the most important thing for us is to understand that for a child or an adult who's diagnosed with a blood cancer or a blood disease, the only chance of survival for many of them is a stem cell transplant. And that's why we're here to create awareness around the need for people to register as stem cell donors.
How much do we know about stem cell donation? How much is out there? How much information is out there?
So, look, there's a lot of information out there, and that's one of our main goals, is to really focus on increasing the level of education. But there are definitely challenges we face. In some instances, there's just not enough information in certain communities and areas. And on the other hand, there's also a lot of myths about stem cell donation. And as much as we create awareness, we also want to create an understanding of these myths that hinder people from registering as donors.
Speak to us about the work that you do. You help patients across South Africa in assisting them to get a transplant. Tell us a little bit more about that.
So what we do is, firstly, the education and awareness when a patient is diagnosed. We try and engage with their communities, with their works, with their schools to create an understanding of what this patient is going through. In many cases, a patient will not find a sibling match, which means they need an unrelated donor match, and we have to call for donors all the time. So we talk about how people can register as donors and what the process is to then register as a donor. And we will also recruit those donors, which comes at a cost to do the DNA or HLA typing. And that's part of the work we do, is to fundraise and recover the costs so that nobody who registers as a donor has to pay out any funds to become a donor. So we do the education awareness. The most important part is to actually recruit those stem cell donors, and then we cover all the costs related to recruiting that donor for a patient.
And funding, are you finding that funders are willing to come on board, or you have to go out there and physically find them?
I think it's a definite combination of both. But the funders are out there, and they've been incredibly helpful through this time, because many of the businesses who fund us are challenged at this point in our economic status and with COVID, and yet they still support for this cause. And we find a lot of individuals in South Africa stepping up and, just doing small donations, supporting us with our work, etc. And that individual giving is so important, especially at this time, because it definitely is a challenge to find funding. But we are incredibly blessed. In South Africa, just the will to want to do good and support is amazing.
And the donors, are you finding there's a big pool, or, what are the challenges in terms of finding donors?
So finding stem cell donors are incredibly challenging because this is a genetic match and not a blood match. We're looking for a genetic twin for a patient, and that depends on your culture and your heritage. So, we've celebrated Heritage Day, and we celebrate the amazing Rainbow Nation in South Africa. But that diversity, it's a huge challenge when you're trying to find a stem cell match. So the chances are less than 1 in 100,000 to find a match. So as much as donors come forward, and we are recruiting donors on a daily basis, we just need so many more donors to register all the time.
How do we overcome this challenge? Yes, we need more to come on board, but where do we find solutions? Do you know what I mean? That it doesn't feel like we're hitting brick walls all the time.
And part of that has really been, I think our media community have been amazing to help us share the story and the awareness. And what has happened is with COVID, we've gone from face-to-face donor drives to these online donor drives, and they've been so amazing. We've really had to look at automating the whole system of recruitment, because of the restrictions. And what we have found, it makes it so accessible. So people are able to register at home, at work, online. So they visit our website, click on the Become a Donor link, complete a brief form. And instead of coming through to a drive, you could either come through to our offices, or our couriers will drop a swab kit off at your home or at your office and then collect them and return them again for us. So in these challenging times, we found easier ways to recruit donors, and South Africans are definitely stepping forward in support.
All right, so let's give a blow by blow. I want to become a donor today. Where do I start?
So the first thing you do is you visit our website. There is a lot of information about how to register, what it means to be a donor and what the expectations would be and what the criteria are. You'll then complete a brief online form, which will get submitted to us, and then we would courier a swab kit to you. When your swab kit arrives, in it would be some more information and what basically looks like earbuds. In them, and it's a swab of the inside of your cheeks and your mouth. It goes back into the envelope, which is returned to us. Those swabs are then sent to our labs, where we will run the DNA or tissue typing test, and those results are stored on our database. So now you're registered as a donor, and what that means is you're one of millions who are registered internationally. You become part of an international source of donors for patients in need of a match. And as a doctor is searching for their patient's match, that's how they would then find your information. Well, they would find your code, they would reach out to us, and we will then contact our donor to then arrange a donation.
You spoke a little bit about criteria. Take us through some of the criteria.
But there's some basic ones. So if you are between the ages of 18 and 55, you consider yourself to be in good health. And the most important thing, that you're really willing to do this to help a patient in need. And often that patient is a stranger until the time after you've donated. And that is really the main criteria that we have. We obviously look at certain health conditions to ensure it's always safe for the donor to donate. And we have an expert medical team on standby for anybody who's maybe on medication or has been diagnosed with something else. And if they want to find out if they qualify as donors, there are some criteria on our website. But one of our qualified donor recruitment teams and medical teams would always assist anyone who has any questions. And that's the completed process. So registration, it's quick, it's easy. It's automated, and you are on the registry until you turn 60, in which case you will come off the registry, or if you are a match for a donor, you would donate once.
And talk to us about organizations such as CHOC that you work with.
So we work with amazing organizations. CHOC is just fantastic. So CHOC focusing very much on childhood cancers, and they offer a range of support services, including accommodation for the child and a family member as they undergo treatment. They offer support in the forms of whether they require food or funding, emotional support, engagement, and they're really part of the journey for a family who is experiencing a diagnosis of cancer.
Alana James, thank you so much for waking up bright and early on Sunday morning to talk to us about the work that they do in assisting children diagnosed with childhood cancer to get a transplant.